Hi, this is Pema Namgil, and I'm about to do my head-to-toe assessment, video assessment on Eric over here. We are at nursing lab at Seneca College, King City. Good evening, Mr. Eric. My name is Pema Namgil, and I'm a nurse student, and I'm about to do a head-to-toe assessment on you right now. And I'm going to close the curtains for my privacy and ensure that you're comfortable and safe over here. Are you comfortable?
Yep.
I'm going to pull the curtains now. Okay, all the way. And I'm going to clean my stethoscope. Clean my stethoscope properly. Perform hand hygiene. Hand is clean. I'm looking at my client over here, Mr. Eric. He seems to be around 20 to 25 years old. His sexual development seems normal according to his age. And I'm looking at his color. His color is white with pink undertones. And I'm looking at his body structure. His posture is erect. His position is good. Body stature proper. And look at his body build. He's athletic. He's athletic looking. Looking at his mobility. Can you stand up and walk across the room, please? So while you were walking, you had no signs of distress. Your breathing is normal. Your gait, you have a proper gait, and you have no altered range of motion. And I'm looking at your behavior, your mood, affect. You have your hygiene. Personal hygiene is clean, and you're dressed appropriately. Okay. And your level of and what's your name? Where are we right now? And what date is it today?
My name is Eric. We are in the student lab. It's April the 2nd, 2013.
Okay. So my client over here is alert and oriented times 3. And I'm going to now inspect his head and check for masses or lesions, anything like that. Doesn't seem to have any masses, lumps, or any bumps, any lesions. His head is shaped normally, and his hair, I'm looking at his hair, is evenly distributed. It's black in color. I'm looking at his face right now. It's symmetrical. His skin color is same as the rest of his color, his face. And can you smile? Can you frown? Can you lift your eyebrows? Okay. Now close your eyes and don't let me open your eyes. Can you puff up your cheeks? And don't let me blow your air out. Okay. So I just tested his cranial nerve number. I just tested his cranial nerve number 7, which is facial, and it's intact right now. I'm now going to look at his eyes. I'm looking at sclera right now. Sclera is moist and china white with conjunctiva. It's scattered with blood vessels. His eyelashes are evenly distributed. His eyebrows are evenly distributed. I don't see any discharge. I'm now going to test cranial nerve number 3, which is oculomotor. I'm just going to do the direct and consensual reflex. Just look at me. Direct, consensual, direct, consensual. His pupils react to the light. Now for accommodation, can you look over there at the light over there? And when you see my finger, you can just focus on my finger, okay? Okay, I see his pupils constrict as soon as he sees focuses on my finger. So there, his cranial nerve number 3, oculomotor, is intact, and I'm now going to measure his pupils. Now I have my ruler over here. Open more. pupil seem around 5 millimeter. 5 millimeter both. The size. His shape is round. It's symmetrical. Okay. And now I'm going over to his ears. Both his ears are symmetrical. Shape are normal. I don't see any cerumen, no discharge. I'm palpating his auricle. I'm palpating his vagus and tragus. Sorry. And you should feel tenderness, but no pain, right?
Yes.
Okay. And I'm now going to do the whisper test. I'm going to whisper 3 words in each of his ear and see if you can hear it. What did I say?
Math, hammer, chair.
Okay. Yeah, and he heard it right. I'm now going to assess his nose. I'm looking at his nose. His nose is midlined. Color is same as that of his face. I don't see any lumps, bumps, or crusting. No discharge. I'm now going to palpate his frontal sinus and his maxillary sinus. This is frontal sinus, and now his maxillary. Did you feel any pain?
No.
Okay. And I'm now going to look at into his mouth. First, looking at his lips. His lips is pink. They're not swollen. And I'm going to look at his teeth. Open your mouth, please. I'm looking at his teeth. I'm looking for the presence there. I'm looking at their color, their shape, structure. I'm looking at his gums. They're pink in color. And they're not bleeding. I'm looking at his tongue. It's pink, bright pink in color. They're symmetrical. I'm looking at his hard and soft palate. They're pink in color and it's not swollen. Yeah. And now I'm going to test cranial nerve 9 and 10, which is glossopharyngeal and vagus nerve. I'm going to. Can you say ah?
Ah.
Okay. When he says ah, I could see the uvula and his soft palate rise, which shows that those cranial nerves are intact. I'm now going to check his cranial nerve number 12, which is hypoglossal. So can you just stick out your tongue? So I see it's midlined. Can you move from left to right? Okay. So can you repeat after me? Light, tight, dynamite.
Light, tight, dynamite.
So his cranial nerve number 12 is intact. Hypoglossal is intact. I'm now moving down in his neck area. I'm looking for any signs of scars. Collar. I'm looking at his collar, the same as the rest of the body. I'm looking at the symmetry. I'm looking at any lumps, bumps, anything like that. I'm looking for jugular vein pressure, which I don't see. I'm looking at any obvious signs of enlargement of thyroid, which is not there, which is normal. Everything is normal. I'm going to palpate his carotid arteries, which is down over here. I'm going to do once on each side. Yeah, they're both regular. They're both equal bilaterally, and the rhythm is regular. The strength is 2+, and okay. And I'm going to test his cranial nerve number 11, which is the spinal accessory. And can you rotate your head on both sides slowly? Okay. And I'm going to put some resistance. Can you lift your shoulders? Sure. Okay. Spinal accessory nerve is fine, and I'm going to go down to his lower extremity. I'm looking at his upper extremity. Sorry. I see the color. They're all normal. They're both symmetrical. I don't see any joint inflammation. I don't see any lesions, any edema, signs of edema. I'm not palpating. I'm just feeling his temperature, which is warm. Moisture. I'm feeling his turgor, skin turgor. Okay. I'm now looking at his nails. His nail angle is less than 160 degrees, and and the shape is normal, and I'm looking at the cap refill, testing the cap refill. Yeah, so cap refill is normal too. Now can you do the range of motion with me? Flexion of fingers and extension of the fingers, flexion of your wrist and extension of your wrist, and hyperextension of your wrist, flexion of your elbows, extension of your elbows, abduction, adduction, shrug your shoulders, internal rotation, external rotation, radial deviation, and ulnar deviation. Okay. So your range of movement is clear. I was observing for any signs of pain or crepitus, no crepitus, and there's no altered range of motion. I'm now going to his lower extremities. I'm looking at the color, the symmetrical, this hair distribution, which I see there's no scars. They're both symmetrical. Color is same as the rest of the body. I'm now feeling for temperature, moisture, turgidity, no signs of edema or anything like that. So I'm going to palpate for his dorsalis pedis and his posterior tibialis, which is at the back. First dorsalis pedis. I can feel that, and I'm going to feel his posterior tibialis. So they both are normal. The rhythm is regular. Is not bounding. Is normal. They're both bilaterally equal, and the rhythm is regular. Now I'm going to test the range of motion. Can you do dorsiflexion and plantar flexion? Okay, and that's okay. And I'm going to sit up. Check his breathing sounds. So whenever you feel my stethoscope on your back, you breathe deep. So his breathing sounds normal. I can't hear any crackles or wheezing or anything like that, or no adventitious sounds. I can hear vesicular sounds along the peripheral area of the lungs, and I can hear the bronchiovesicular on the midsection over here, which is normal. And I'm now going to palpate his back, looking for the temperature, moisture, same thing. No moisture, turgidity. Yeah. So you can sleep down. I'm going to put the under your knees and I'm going to check for cardio. Drape him. I'm going to check for cardiovascular sounds, for heart sounds, okay? Just breathe normal. Hello? So I listened at the aortic valve, which is over here at your right second intercostal space, at your pulmonic valve at your left second interspace, at your tricuspid valve, which is at the fifth interspace, and your mitral valve, which is at the fifth interspace at left mid-clavicular line. And I can hear S2 sounds best at the base, around over here, and I can hear the S1 sounds best at the apex, near the mitral valve. And I'm now going to inspect your abdomen. I'm looking at your abdomen. The umbilicus is midlined. There's no strays or anything like that. The skin color is same as everything. It's symmetrical. I'm now going to auscultate all the four vowel quadrants, for vowel sounds. So I can hear vowel sounds in all four quadrants, and I'm now going to just palpate, just feel for rigidity, any signs of resistance, tightness, any feeling for superficial masses. I don't feel anything, and I'm now going to just feeling your bladder, which I don't feel right now, and our head to toe body assessment is done.